All right. Hello, class. Welcome to this week's YouTube lessons. This week we are talking about our circulatory system. So I am going to go ahead and present my screen. You guys should be in your Google Classroom. When you're in Google Classroom, you're on this week's slideshow. When you're on this week's slideshow, you'll see Monday's lesson is day 1 of our circulatory system. As you see, we're just going to be going through slides 1 through 15. Go ahead and open your assignment. Same thing, you're going to do your do now question. You are going to make sure you're taking notes for the test. And then also any questions I have within the slides. Usually every ending slideshow, I'll have a question for you guys to answer. And that's what I'm looking for to get your full 10 daily points. So I'm going to go ahead and open up today's lesson, our circulatory system. So first things first is your do now question. Go ahead and answer, what do you know about the system? So when you hear of your circulatory system, those who don't know, that means your blood and your heart. So maybe that's all you knew about it. What do you know about this system? Maybe you know any issues with the heart. Maybe you know how the heart works and anything you have an idea about. Or if you say, Coach Go, I have no idea, I hope to learn. And trust me, we're going to learn. All right, so once you guys are done answering that, we're going to go ahead and go to the next slide. So last week we talked about our different muscles. Remember, we talked about the 3 types of muscles. You have skeletal, you have smooth muscles, which are your organs, right? We talked a lot about your digestive organs. And then we talked about your cardiac muscle. That's your 3rd type of muscle, where your cardiac muscle is your heart. I told you the true name for your heart muscle is called your myocardium. M-Y-O, myo means muscle. And obviously anything with the word cardium, cardio, cardiac has to do with your heart. So it's the most important muscle of your body. Obviously without our heart, it won't keep us alive. It beats on average about 80 times a minute. As this lesson goes on, the very last thing we're going to show is exactly how many times a minute your heart beats. Obviously, when you guys are working out, or unfortunately, some of us who might not be in the best shape and you're about to work out, it's going to be a little bit faster. So we're going to be talking about why it's important to get our heart nice and strong, because you don't want it to beat so fast just on a relaxing basis. It needs to be beating fast when we're obviously putting it under some strenuous activity. But on average, it beats about 80 times a minute, which is about 100,000 times a day, 42 million times a year. So your heart is constantly beating, right? Constantly beating. So we got to keep that heart nice and healthy. So where's your heart located? Technically, your heart is located the left center of your chest. Left center of your chest. Your heart's about the size of your fist. Tomorrow we'll talk about there's some illnesses and issues. If someone has an enlarged heart, we'll talk about that tomorrow. But your heart's only about 8 to 10 ounces. If you think, how big is that? If you think like probably an average piece of steak, the average piece of steak is probably about 6 to 8 ounces. So that's probably about the size of your heart, just on average. Like I said, it's located the left center of your chest. You're going to learn at the end of this week when we talk about your respiratory system, how your left side of your lungs gives us some space for your heart to fit. Okay, so I told you your body's so amazing. Mind you, we just talked about the digestive system last week, your esophagus, your intestines, your stomach, your pancreas, your liver, all that stuff, how it's all just in our torso underneath our rib cage. Well, your heart's obviously in there too. So your body is so amazing with how it's structured and how it layers things on top of layers so everything can fit it nicely into place. All right. So 3 things your circulatory system does. First thing it does is it pumps your blood, obviously. Without your heart, you won't have blood to the top of your head, to the bottom of your feet. You won't have blood going to the pulp of your tooth to keep your teeth nice and healthy. You won't have blood going to your bones, specifically in that bone marrow that helps makes these blood cells. So you got to think about everywhere that blood is being pumped. Obviously, your heart is the main system that pumps it for us. When it pumps the blood, it obviously does 2 main things. It delivers the oxygen and it removes the waste. Particularly, we'll be talking about CO2, which is carbon dioxide. It also removes a lot of waste, which we'll talk about through your kidneys. When you guys go number 1, our urine. Okay, so it'll talk about how it also removes waste besides just breathing out CO2. But without your blood and blood system, the circulatory system, we wouldn't be getting oxygen to every area of our body, and you wouldn't be able to remove the wasteful natures of our body. All right, moving on. Okay, so this picture shows you actually like a true look at what your heart looks like. Your heart's not like a pretty little Valentine heart shaped. I mean, obviously they probably do that because who wants to get a picture of this right on Valentine's Day? But this is pretty much what your heart looks like. It is bluish and reddish, and that just pretty much shows you, which we'll talk about in a few slides. The bluish areas are the deoxygenated blood side, and the reddish areas is the oxygenated blood side. Okay, so if you see on my slide here, I said the right side of your heart pumps to the lungs. Now, remember last week when I talked about when you look at a picture of a heart or a picture of a body or a picture of something that's on a body, you can't look at it like you're looking at it, like this is the right side, this is the left side. No, you have to look at it as if that picture is facing you. So technically, if you see this blue side, that is the right side of the heart, and the red side is the left side. So always picture someone standing in front of you, and that's how you're looking at them. So you got their left side and their right side. Okay, so you just flip the image. Those who are going into the medical field, that's an easy thing just to remember. Just someone's facing you instead. So it says here, look at the blue part, okay? That's all deoxygenated blood. We'll learn that side of your heart pumps back to the lungs, okay? So when you pump it back to the lungs, it's pretty much getting rid of that waste, and then we'll talk about the CO2, how it expels it. The left side is the red side. We'll learn, I always talk about the left side is the strong side. That is what pumps it to the body, so it has all the oxygen. So when you breathe in all that oxygen, how it goes to your lungs, it sends that oxygen to the left side of your heart, and your left side of the heart says, thank you, let me send this where it needs to go, whether it's to your brain, whether it's to your eyeballs, the sclera, remember the white part of your eyeballs has the blood vessels, maybe it's to my pinky toe, maybe it's to my spleen, wherever that oxygenated blood needs to go, which is everywhere in your body. But obviously, if I'm working out, then it's going to maybe have to send more oxygen to like my lower legs because that's what's using more oxygen. So that part of your heart sends it. Easy way for me to remember, if you guys ever seen that movie, Remember the Titans, one of my favorite movies. There's a scene in the movie where it talks about the guys put their hands in, they're about to huddle and break out, and they say, left side, strong side. Well, that part of the movie, just think about it. The left side of your heart is the strong side. Now, don't mean the right side's not strong. Obviously it is, but when you think about in terms of oxygen versus no oxygen, okay, we want oxygen. So always see that as the strong side. So left side, strong side. All right. Okay, let's move on. Okay, so how much blood is actually circulating in our body? We have about 5 quarts of blood. So that's like a gallon's 4 quarts. So you have a gallon plus an extra quart. You think about like a gallon of milk plus like a little quart of milk. That's technically how much blood is constantly circulating in your body. As you sit here watching me, as I'm here teaching y'all, as you guys are walking to class, as you guys are laying in bed, you have about 5 quarts of blood just constantly circulating through your body. Your heart pumps about 2,000 gallons every day. So think, you have that big gallon milk jug, right? You fill it up with milk, you dump it out. Fill it up, you dump it out. And you do that 2,000 times a day. That's pretty much like how much blood is actually being circulated in your body. If you ever donate blood, which I'm a proud donator, whenever I can, I'll go donate my blood. They do not take out more blood than you can't survive with. We told you when we talk about your skeletal system, your bone marrow, the very inside layer of your bones constantly is making new blood cells. So it's not like if I donate blood, they take a pint out. Well, you know, there are 4 pints in a quart, right? There's 5 quarts of blood in your body. So they just take a pint out. It doesn't mean I'll never ever get that pint back. No, my body makes new blood. Your body makes all these new cells to keep replenished, right? So when they take that pint of blood out of me to donate to someone else, obviously I can't go back within a certain number of days because they want to make sure my blood then replenishes and then say, okay, now you can come back and donate another pint. So if you ever donate blood, they're not taking away your blood. Your blood will then be recirculated, replenished, and you should be fine. But this is why it's scary, though. If someone has a really bad injury and they're bleeding out, someone can bleed to death. Because once you get below that level of blood in your body to get oxygen wherever it goes, that area might die off, right? Or I might bleed to death. So it's really important. Someone has a really, really bad injury where they're bleeding, we apply pressure and call 911. We want to keep in as much blood as possible, right? All right, moving on. Okay, so now we're going to actually break down the anatomy of the heart. So when you think about your heart, okay, I like to think about them as like a big, big bowl that has 4 little bowls. So you technically have 4 chambers of your heart. You got your upper 2 and your lower 2, okay? So your upper 2 chambers of your heart, those are actually called your atrium. If you think about just one of them, it's called atria. But when you think about both of them, they're called your atrium. So you got a right atrium and a left atrium, right? And then when you talk about the bottoms of the hearts, you have a ventricles, a right ventricle and a left ventricle. So when I ask you how many chambers of the heart, there's 4. So think you got this big old heart, make a cross, and you got 4 sections, okay? Now, your atrium, pretty much basic thing what they do, they receive blood from either the lungs or the body, okay? So if they receive it from the lungs, that is good blood, okay? And I say good blood like oxygen, so that's the blood that's going to be pumped right out to your body. Well, when you got to pump the blood back through, so once your blood goes and it sends the good stuff, it's going to pick up the waste. And when it pumps it back through, it's going to go back up to the other side of your atrium, which is your right side, and that's going to fill with blood. So the top part of your hearts is always what's the first part that fills with blood, okay? Now, when that top part fills with blood, it says, well, what do I do now? Well, it's like there's a little gate on the bottom of the bowls, and it opens up, and they both fall down to the lower bowls. Those lower bowls, as it says down here, are your ventricles. So you got your right ventricle and your left ventricle. So now you say, now what happens? Well, once that area fills up with blood, then it pumps and squeezes it where it needs to go. So for example, the left ventricle, which is the good oxygenated blood, that is what sends it wherever it needs to go in the body, whether it's to your brain, whether it's to your calf muscle, whether it's to the pulp of your tooth, wherever it needs to go, it sends it, right? The right side ventricle is the side that has no oxygen. So this is the blood that came back that was already used. And it says, well, what do I do with it now? And your right side of your heart says, I'll take it. So when it drops your right ventricle, now it sends it to the organs that get rid of the waste. So it sends it through the lungs, and then it gets rid of the CO2. It sends it to the kidneys, and it gets rid of it as urine waste. It sends it where it needs to go to filter out, to get rid of the bad stuff. Now, obviously, you're not breathing out blood. You're not peeing out blood, right? If any of that happens and there's something else going on, go see a doctor about it. But you're getting rid of the waste that are within that blood, okay? Your blood is constantly traveling, but once it travels to an area that can get rid of waste, it takes the waste and gets rid of that for us, right? I know it sounds a little confusing, but if you just think of your heart and just make a cross, you got upper bowl, those are your atrium, lower bowl, those are your ventricles. Right side, no oxygen, left side, oxygen. In a few slides, I'll show you a picture, makes a little bit more sense on that, okay? As you see, anytime I have blue writing, that's the area that has no oxygen, okay? And then the red writing has oxygen. Okay, so let's get into the blood vessels. So you have 3 types of blood vessels. You have your veins and your arteries, which probably a lot of you guys know about. And then you have your capillaries. A lot of people forget about those capillaries. But your veins, okay, all of these blood vessels, understand, they're all connected. So everywhere they're connected, you got to think there's like little valves. Think of valves as like little gates that open and close, right? Think last week when I talked about your digestive system, you have your esophagus and your trachea, but you had that little epiglottis that blocked it so we didn't like choke on our food. Okay, so you got to think wherever vessels come together, you have valves that open and close, right? So your veins are bluish. If you guys look on your guys' hands, you see your veins, those are the bluish areas. Those are deoxygenated blood, okay? So it's still blood, but obviously it's bluish, it's purplish, because that has no oxygen. Your veins are taking it back. It's taking it back to your heart, and then it's saying, hey, heart, go get me more oxygen. So the heart says, okay, send it to the lungs. It's telling the lungs, go get me more oxygen. Okay, so that's the veins. Your arteries are red. Now, you guys know if you ever cut yourself, your blood doesn't come out like if it hits the air, okay, it comes out red, right? Okay, so like if I cut a vein, it doesn't come out blue blood because what's in the air is oxygen. It makes it red, right? So your arteries is constantly red blood. And I say red blood, but think of that as oxygenated blood. So your arteries has good blood. It's sending it to your body. We have huge, huge arteries in our body, which we'll talk about here in a second. But that is what sends it where it needs to go. Okay, now these veins and arteries, they don't just meet up. Okay, they're actually, what's in between each of these is a little guy called a capillary. That's also a blood vessel. Think of your blood vessels, your capillaries, as like, I call them middlemen. They're the guys that get the good blood and give the bad blood. So think like, if I'm going to sell something on buy sell trade, right? And I have something to sell and someone wants to buy it from me. Well, I might go meet at a certain location, okay, and I might pay that person, give him the item, and then that guy pays him, and then we make the switch. That's the capillary. Your capillary is the guy that says, okay, what you got for me? Give it to me. okay, what you got to give them, and they make the switch. So think of the capillaries as like the middlemen. And that's what this picture shows down here. You have your artery, which has the red blood cells. And I like to call those blood cells like little blood boats. So it has the good oxygen. Okay, and it says, okay, I got good oxygen veins. What you got for me? Well, then the capillaries will ask, hey, veins, what do you got for them? The vein says, hey, I got some blood boats, blood cells that don't have oxygen. They say, okay, let's make the swap. And the capillary is the guy that literally makes the swap. Okay, so they're all connected throughout your body. I mean, we have millions of miles of blood vessels throughout our body, right? But the capillaries are the guys that says, okay, give me the good blood, which is the oxygen, give me the bad stuff, and it makes the switch from, and then the veins and arteries takes it where it needs to go. Whether the arteries take it to the body, right? Or the veins say, hey, let me take this back and get new, better blood, right? All right, so those are the blood vessels. There's 3 types. Okay, so this picture is probably what explains it a lot easier. I want you guys to go ahead and copy this into your notes. So this picture right here, let me break it down for you. Okay, it's so easy to understand, but let me break it down. So if you guys see right here, these 4 boxes, like I said, that's your heart. If you take your heart and you make a cross, you got 4 bowls, right? The top 2 bowls are your atrium, the bottom 2 are your ventricles. Remember, like I said, the right side is the deoxygenated side and the left side is the strong side. So think, someone's looking at you. That's their left side, that's their right side. Okay, so we're going to talk about focusing on your lungs and the respiratory, which we'll talk about this week as well, how these 2 systems, without one, you can't have the other. So what do your lungs do? When you guys breathe in there, what are we breathing in? Obviously oxygen, right? And think, when I'm working out, I'm breathing in more because I need more oxygen because my muscles need that oxygen because they're working out, right? So when you breathe in oxygen, you're breathing in oxygen. It is then going to send it to your heart, okay? Your lungs say, hey, I got oxygen, sends it to your heart. Now remember, when I say sends it, it doesn't just like snap his finger, goes there. It goes there through blood, right? Your blood cells is what says, yes, send it there, and it sends it through blood. That's why we talked about, it's scary if someone has cancer, how easy it can spread because it spreads through the blood. If someone has an infection, how easy it can spread because it sends through the blood. Your blood goes everywhere in your body, right? That's how everything is pretty much connected, right? When you eat healthy nutrients, it sends it through the blood, right? So when your lungs get that oxygen, the first place it says, let me go to the heart, left side. So it goes to left atrium. When it fills up this left atrium, it says, okay, I'm full. Once it's full, remember I told you what it does is it opens up that gate and drops it to the bottom one. Well, that bottom bowl is your left ventricle. Once that bottom bowl is full, it says, okay, I got some good oxygen blood. Where do I go now? Well, why did we breathe oxygen in the first place? To send it to our body, right? So that left ventricle says, I got you, let me send it to your body. So as you see, the red arrow then goes and it sends it to the body. And when I say to the body, it could go in any direction. You have 3 main areas it's going to go to. It's either going to go to your head, your brain area. It's going to go to your torso, which is think from your neck to our pelvis, or it's going to go to your extremities, your arms and your legs, right? So it has like 3 main pathways it can go. So obviously it's going to go to all of them, but maybe it's going to focus a lot more on my extremities this round because maybe I'm in the gym working out. I need more blood flow. Or maybe it's going to go more to my brain because I'm really focusing, studying hard on a test. It's going to send more energy to my brain. So obviously it has these main pathways. Once it goes to the body, remember the body says, here's the good stuff. Well, that blood is going to come back with the deoxygenated blood, the bad stuff, right? So when that blood comes back, the body says, okay, well, I got deoxygenated blood. Like, well, what do I do with it? Your right side of your heart says, give it to me. So that right atrium says, I will take it. Okay, so it fills up. Once it fills up, the gate opens and drops it to the right ventricle. Now your right ventricle says, okay, I'm full. What do I do now? Well, your body says, well, let's get rid of it and let's get better blood coming back. So your right ventricle then pumps it out. And as you follow these arrows, it pumps it. Now this waste is carbon dioxide. I don't want you to think every waste is sent back to the lungs. But for this image, we're talking about your respiratory and circulatory. So it comes and it sends it back to your lungs. And your lungs says, okay, we will take this. And when it's in the lungs, it then makes a switch again. Give me the bad stuff. Here's the good stuff. So that constantly happens. Every time your heart beats, this is what's happening. Good blood to your left atrium, left ventricle sends it out. And then when it beats again, to your right atrium, right ventricle, and it brings it back. So you got to think every time your heart beats, it does this process, right? Now, When it comes from the right ventricle, I told you for this diagram, we're talking about carbon dioxide waste. It sends it to the lungs. Well, maybe it's waste, like I said, urine type of waste. Maybe it's waste that needs to be filtered out. So instead of this arrow going to the lungs, it might send it to the kidneys. It might send it to the spleen. It might send it other areas, and then you're able to expel it from your body, right? But for this diagram, we're more associating the lungs with the heart. Okay, so you got to think every time your heart beats, it's literally going through this process. Okay, as long as it sounds to say left atrium, left ventricle, body, right atrium, right ventricle, lungs, you got to think it did it. It did it. It did it. That's how fast. And think when you're working out or if you're nervous, right, it's beating that much harder. So it's putting all of this into effect within that short amount of time. All right, so let's move on. Okay, so obviously we talked about your heart's a big old muscle itself. Well, you have a muscle within the muscles, right? And this big muscle right here is called your septum muscle. This is what pretty much divides the heart from left to right side. Okay, so this shows you a little bit more accurate view of like those bowls I talked to you guys about. So if you guys look here, here is your left atrium, right? This little bowl up top. So this section down here is your left ventricle. And then here's your right atrium, this bowl right here. And then your right ventricle. Okay, and then you have this huge septum muscle that separates the two. Tomorrow when we talk about enlarged hearts, we'll talk more about this muscle and how it can have an impact on someone's heart conditions. All right. I want you guys to see, anytime you guys see these words right here, see pulmonary, pulmonary artery, pulmonary vein, pulmonary veins. Pulmonary means lungs. If someone has a pulmonary issue, it has to deal with their lungs. So everywhere you say pulmonary, the pulmonary artery, that is where the lungs is giving you the good oxygen blood. Remember, arteries is the red, good oxygen. Pulmonary veins, that's where you're sending it back to the lungs, no oxygen. Okay, so the word pulmonary. All right, moving on. Okay, so valves. I told you, each of these bowls, so to speak, there's like a little gate system. It's a valve, right? Just like that epiglottis, right? Or your artery connects to a vein via a capillary. There's like little valves that open and close to let the blood through, right? Think of them as like little bodyguards of their area, okay? So what valves do in the heart, they keep blood in their chambers, right? So when you guys hear an actual heartbeat, when you hear this, right, a doctor puts on their stethoscope, they tell you to breathe. They're listening for that sound. It really is like a whooshing sound. It's like, if you ever hear a heartbeat or listen to mom's ultrasound if she's pregnant and that's what you hear, that's a sound of blood going through. They're listening if it sounds like, it's like a continuous type of sound. They could pick up if there's like a disturbance in there and an issue. And one of the issues could be the valves. Your valves is that quick, lubbed up. Every time your heart's beating, you got to think open, close, open, close. Your valves are opening and closing. So when you're full, your upper chambers are full, your valves will open, okay? The blood drops down and closes. And then when these are full, the valves will open and shoot it. So it's constantly open, close, open, close, open, close. So you got to think, the more our heart beats, like I said, about 80 times a minute, about 42 million times a year, right? That's a lot of work that these valves are doing. Unfortunately, people who aren't eating healthy, they're stressed out, they are smoking, they're not exercising, all of these put you at risk. And your heart says, man, I'm going to keep you going, but now you're making me work harder. And this is, they're resting, okay? Your heart is beating probably double what it needs to be. Well, eventually your heart's going to say, man, this is too much. And it can stop. And that's when people have heart attacks. #1 heart killer of Americans, I told you, is heart disease. Your valves can also get ruined. Now, I wanted to let you guys know, like, the older you get, your valves, it's constantly open, close. So you could have valve issues. My grandma, a few years ago, when she was still here with us, she had to go in for valve surgery. I mean, she was in her late 70s, early 80s. Your valves just eventually, like, they just wear out, right? And she was healthy as can be, but they wear out. And the reason why she knew about it is because her doctor wouldn't listen to her heart. He heard the and it was offbeat. If you ever have like a heart murmur type of issue, one of the reasons could have been maybe a valve. So her valve wasn't fully closing all the way, so blood would like trickle down to the other chamber, which obviously wasn't normal, wasn't healthy. So they went in and they replaced that valve for her. It's like if you have a door and after so many times of opening, closing, well, eventually the hinges might not work effectively. Might need to just spray WD-40 on it, make it feel better. But either way, they have to go in and maybe fix those hinges, right? These are the 4 types of valves. I won't make you know these on a test, but you ever go in the medical field, you need to know you have your mitral and tricuspid valve. Those are the ones that empty it from the atrium chambers to your ventricles. And then you have your aortic and pulmonary. Aortic, whenever you hear aortic, that's like a big part of your heart. And that's what sends it to either, like I said, your head, your extremities, or your torso. So you got to think that's where the good oxygen blood's now being sent to those 3 areas. And then you have a pulmonary valve. That's when it's sending back. Remember, pulmonary means lungs. It's sending it back to your lungs to recycle deoxygen blood from oxygen blood. Okay? All right, moving on. Okay, so we're going to talk about your kidneys now. I talk about the kidneys in this section because one of the main jobs it does is help clean our blood, filter our blood, and one of the byproducts is the waste, which is the urine, right? So most people have 2 kidneys. If you guys don't know, they're on either side of your spine. Let me show you guys a picture just below your rib cage. So here's a picture. And you got to remember, you got a whole bunch of digestive organs that aren't showing right now. And you got your rib cage, but your kidneys are towards the back of your spine. So you got kidney here, kidney here. Like you can see, this red and blue tubes are veins and arteries. These yellow tubes down here are then connected to your bladder, right? Those who don't know, this is a female because we got uterus and ovaries, so it's a female. But guys, obviously, you don't look at the reproductive system. You got the kidneys that go down to your readers. Think urine, and it sends it to your bladder muscle, and that's how you end up going pee, okay? But you have 2 kidneys. They're located on each side of your spine. They're about the size of your fist. They call them kidneys because they're shaped like kidney beans. They're connected to your bladder. So like I said, when your blood needs to be filtered and cleaned out, one of the places it goes is to these kidneys. Your kidneys like filters it. That's what it says down here. It removes the waste and extra fluid from your blood. The stuff that we don't need, it sends it to your ureters and you pee it out, right? You go number 1. The stuff that's good, it sends it right back and it circulates through our blood system, okay? So think about what your kidneys do. It helps also make red blood cells, controls your blood pressure. Like I said, the main thing we're focusing on is how it cleans your blood and gets rid of the waste. So when your heart connects to your lungs get rid of the carbon dioxide. Well, obviously, you're not going to have pee coming out of our lungs, but it's going to go through your kidneys and it comes out the opposite end. So that's just showing you how all these systems are connected. You have 2 kidneys, right? But you can live with 1. So if you know someone who needs a kidney and you're a match for them, you technically can live with 1 kidney. All right, so they could remove 1 and you would just have 1 connected to your bladder and you can live with it. You can't live, though, without at least 1 kidney. People who go on kidney failure, kidneys mean renal. So for anyone's in renal failure, that is the issue that they're having is with their kidneys. All right, let's move on. Okay, so now we're talking about pulse rates. RHR, what does that mean? Resting heart rate. So a typical person, and this is just like when you're chilling. You're hanging out, maybe you're sitting in class, maybe you're just sitting here watching this. Your beats per minute, that's what this is, beats per minute should be about 60 to 100 beats per minute. The lower you are, like in the 60 range, that's typically the healthier your heart is. Because like I said, if I'm just sitting here, my heart shouldn't have to beat so hard. Okay, you got to think if it's constantly beating like this, it's working that much harder. Because it's working that much harder, it's probably not in the best shape. Your body says, I got to work harder. Well, eventually it does this, you're in and you're out. You're more known to have heart attacks, heart issues, right? Well, my heart is probably just beating, just chilling, right? Just enough to get me my blood to my body, okay? The people who are lower, like in the 60s, you got to think these are probably your like really trained athletes who go through extensive training. When you're training your cardio, you're making your heart stronger. So when it pumps blood, it sends so much more in one pump. And it doesn't have to pump again for, a few seconds compared to someone who doesn't work out. Their heart only is able to pump a little bit and says, well, I got to keep pumping because I can only pump so much at a time. Okay. You have, like I told you, huge arteries in your body. So 2 of those huge arteries is your carotid artery, which is your neck, and your radial artery, which is your wrist. Called radial because this is your radius bone, right? So you got your carotid and your radial. I say these 2 because these are the 2 that most people find your blood pressure on. Right? You also have that huge artery in your femoral artery. Remember, your femur is the longest bone in your thigh. So femoral artery is like right there in your groin. Okay. If you could feel in that area, you could feel a heartbeat. Okay. So those are like the main locations where heart is really, really, really easy to find a heartbeat. Okay. So with that being said, we're about to check our pulse. So in your guys' notes, what I want you to do, we're going to find our pulse. So right now, go ahead and either feel your carotid artery or your radial artery. Now, when you feel it, don't use your thumb because technically you have a little heartbeat in your thumb. It could throw you off. So you want to use your 2 fingers If you feel here in your neck area, remember, you're going to feel like these like muscles that are in there. You want to sort of dig around in there, and you can feel that faint lub dub. I like to find it more in my pulse. So you want to find it, remember, thumb side, your radial artery. You can't just set your hand on here like this. You actually have to like relax your wrist, and you'll feel in between your tendons, okay, in between those cords. Just locate in there, and you should feel that heartbeat. Lub dub, lub dub, lub dub. So once you guys find your pulse, okay, I want you to count your beats for 10 seconds. So I'll time you, okay, and then when I say go, just count every time it says lub dub. Now, this isn't 1, 2. This is 1, 2, 3, 4. Okay, so when I say go, I want to find your pulse and count. And stop. So whatever number you're at, go ahead and write that down. So maybe you got to 8. Maybe you got to 12. Okay, I don't think anyone should really be below 8. Maybe you just didn't count a beat right. Maybe you got 12. Maybe some of you guys got 15 or 16, right? You're going to take that number and multiply it by 6. And that is technically what your resting heart rate is. So if mine was, it only beat 8 times in those 10 seconds, well, 8 times 6 is 48, which is actually pretty low. So most of you guys should probably be in the 10s, to be honest. So if I got 10, so 10 times 6 is 60 beats per minute. If you got 15, okay, so 15 times 6, and that's how many times your heart beat in a minute. Like I said, you want to be closer to the 60s range, 60s, 70s. That means your heart's not having to work as hard. Now, if I said right now, let's everyone jump up, do like 10 jumping jacks, and then check your pulse. Well, obviously your heart rate's going to go higher because it's having to work, because it's needing oxygen to those muscles that you're about to work out. Okay, but just chilling, just resting, your heart shouldn't have to work as hard. So if you're noticing, man, it does work as hard, or I do get tired if I'm going up and down stairs, then that's telling us we need to, one, make sure we're eating healthy. We need to make sure we're getting the exercise. Maybe we're not sleeping right. Maybe we're high stressed out. We got to take care of our hearts. We only got one heart, right? So we got to take care of it. So I'm going to go ahead and stop sharing this so I can see y'all now. So we just talked about, like I said, the main anatomy of our heart. You got 4 chambers, your atrium and your ventricles. We talked about every time it opens and closes, those are your valves, lub dub, lub dub. Okay, we talked about left side, strong side, that sends it to your body. The right side is deoxygenated. It'll send it to whatever organs to get rid of it. We focus more on sending it to the lungs and you breathe out CO2. We also mentioned it can send it to your kidneys. Your kidneys filters it, and then it goes to your bladder, and then you pee out that waste. So there's different ways your body expels its waste, right? We talked about you only need 1 kidney to survive. Having 2 is awesome, but you only technically need 1. And we talked about your 3 types of blood vessels. You got arteries and veins, and the middle guys are capillaries. So that's the guy that says, give me the good, take this, take this, take this, right? But we got to make sure we start taking care of our hearts a lot more. Like I said, get 20, 30 minutes of type of exercise a day. Make sure you're eating healthy foods. Believe it or not, your blood goes to every system. We got to take care of our bodies to take care of our internal systems. It's not just the outside we're trying to make look nice, strong, and fit, but it's the internal organs. And obviously those are the issues that people are having problems with, those heart disease, the diabetes. So we got to make sure we're taking a better care of ourselves so we can have that longer quality type of life that we want. All right. So if you guys have any questions, holler at me. Tomorrow we will talk more about issues of our heart diseases, heart attacks, CPR, that kind of stuff. So hope you guys learned, and I'll see you tomorrow. Bye.